This is a presentation on childhood obesity by Kristin Wheeleys.
Today, about 1 in 3 American kids and teens are overweight or obese, which is nearly triple the rate in 1963, according to the American Heart Association. With good reason, childhood obesity is now the #1 health concern among parents in the United States, topping drug abuse and smoking, and today I'm going to inform you on the reasoning behind childhood obesity and the health effects that it can cause. I'm sure many of you have seen plenty of children that are overweight or obese, or you may even know a child that is overweight or obese. Today I will define and explain what childhood obesity is. I will provide you with statistics and facts on childhood obesity. I will inform you on some of the causes behind childhood obesity, as well as inform you on the health effects of a child being obese. I will begin with defining and explaining what childhood obesity is. According to the Center for Disease Control and Prevention website, childhood obesity is a serious medical condition that affects children and adolescents. It occurs when a child is well above the normal weight for his or her age and height. Body mass index is a measure used to determine childhood obesity and overweight. It is calculated using a child's weight and height. BMI does not measure body fat directly, but is a reasonable indicator of body fatness for most children and teens. As the CDC website states, children and adolescents, overweight is defined as a BMI at or above the 85th percentile and lower than the 95th percentile for children of the same age and sex. Obesity is defined as a BMI at or above the 95th percentile for children of the same age and sex. Now that you have an idea of what childhood obesity is, I'm going to provide you with some statistics of childhood obesity. You can find statistics on childhood obesity just about anywhere. Data from the Center for Disease Control and Prevention website states that approximately 17%, or 12.15 million, of children and adolescents aged 2 to 19 years are obese. Since 1980, obesity prevalence among children and adolescents has almost tripled, and obese children are more likely to become obese adults. Now that I have shared some statistics, I'm going to inform you on some of the causes behind childhood obesity. Erica Roth stated on the Healthline website, family history, physiological factors, and lifestyle all play a role in childhood obesity. Children whose parents or other family members are overweight or obese are more likely to follow suit. But the main cause of childhood obesity is a combination of eating too much and exercising too little. According to the Healthline website, a poor diet containing high levels of fat and few nutrients can cause kids to gain weight quickly. Fast food, candy, and soft drinks are common culprits, as well as convenient food such as frozen dinners, salty snacks, and canned pastas. Children who do not get enough exercise are more than likely to gain weight, which could lead to childhood obesity. Children who are not encouraged to play outside or have the opportunity to be active and burn extra calories through sports are also more than likely to become overweight or obese. Childhood obesity can have a harmful effect on the body in a variety of ways. According to Erica Roth, children who are obese have a higher risk of developing health problems than their peers who maintain a healthy weight. Diabetes, heart disease, and asthma are among the most serious risks. Kids and teens who are obese may also suffer from sleep disorders such as excessive snoring and sleep apnea. This is because extra weight in the neck area can block the airways. The American Heart Association website states that there are also psychological effects. Obese children are more prone to low self-esteem, negative body image, and depression. Being obese has many harmful effects that not only affect children when they are young, but as adults as well. There are consequences behind being obese. Some can be minor, some can be severe. Today I talked about childhood obesity. I defined and explained what childhood obesity is. I provided you with some statistics and facts on childhood obesity. I informed you on some of the causes behind childhood obesity, as well as informed you on health effects that child obesity can cause. To many of you, my speech has informed you on a topic that you are most likely already aware of. I leave you with this quote about the severity of childhood obesity, which comes from the American Heart Association website. Former Surgeon General Richard Carmona says, "Because of the rates of obesity, unhealthy eating habits, and physical inactivity, we may see the first generation that will be less healthy and have a shorter life expectancy than their parents."